Stephen Simbwa is 26 years old, a man whose future is now uncertain as he lays on a bed at Mulago Hospital, almost fully paralyzed. With a mother's everlasting faith, his mother Justine Nambogo will not give up on him.
He was hit with an iron bar in Neurosurgeons at night while riding a bike.
He was left for dead. His attackers fled with his motorcycle. He was found the following morning by Neurosurgeons residents.
They brought a police patrol car which brought him to Mulago. It was then that I was called.
Justin was told that part of Stephen's brain had been pierced by a bone.
He was operated on, but now I worry about that eye. It seems like it is gone. And now his left side, I'm not sure whether he will even function again. It appears like only God will intervene.
For now, the doctors are doing their best to restore his health. But it will be a medical miracle, according to Dr. Michael Muhumuza, one of Uganda's only 6 neurosurgeons. Of the 6, 4 are based at Mulago.
You see how the bones have been shattered there? It's quite a big bang. It's most likely a metallic object. Now, unfortunately, when it goes into the brain, you see that fragment is in the brain. It's caused damage around there. Unfortunately, once brain damaged, it's very hard or doesn't recover.
Some of Stephen's bones went into the brain, while others seem to be missing.
The damage depends on which part of the brain has been affected. If it's a speech center and it's really damaged, patient won't talk for life.
His days of earning a living as a boda rider are definitely over.
The left leg and hand might not be as normal as it was before.
As we ask about what his length of stay here may be, Dr. Muhumuza introduces us to another patient who is almost brain dead.
The average stay of head injury patients here is not less than 2 weeks. Usually it's beyond 1 month. And God is still struggling for life.
For almost 5 months now, 38-year-old Muzafaru Obed has been lying in a vegetative state.
He was 14, then he was knocked by a boda man. But that boda man was dead. He died that day.
Gertrude Birungi, his wife, is however glad that the father of her 2 children survived death, despite the fact that his condition is alarming.
This one will need long-term rehabilitation. If he had somewhere near where he could be rehabilitated, there is not much we are doing for him now, just sustaining him.
The length of admission in hospital for most of these patients is worrying to the caretakers. Gertrude had to move out of her rented room.
But the good thing, I got the sponsor who has been buying the medicine tablets. Sometimes I get porridge like that. Feeding, I have been trying. But if I fail, he stays.
Cases of iron bar attacks are said to be on the rise, with Mukono district taking the lead.
Keep preaching to the masses, to the public, so that they try and avoid this, what I would call death traps. It's, I think, something that's avoidable. Prevention is better than cure.
Already there is need for expansion of the unit, which allows for 25 patients, but brims with over 50 at any given time, with other brain ailments like brain tumors, spinal cord injuries, babies born with head swellings, and even cases of domestic violence. The country for now needs about 12 more neurosurgeons placed in regional referral hospitals. Meanwhile, Dr. Muhumuza advises boda riders to avoid dangerous pathways and instead operate in well-lit areas when working at night. Florence Nalimba, NTV.